Welcome to the Sunshine Training Center. For tips, how-tos, and videos on burn rehabilitation, subscribe to our YouTube channel or visit our blog at www.sunshinetraining.org. Coban is often recommended to wrap fingers as a pressure therapy intervention aimed at controlling edema and burn scars. We've covered how to use Coban in a previous video, so if you haven't seen that yet, we encourage you to check it out first. But Coban may not be readily available locally, or it may be too expensive for some patients. In such situations, gauze wrapping offers an effective and affordable alternative. This method is particularly valuable during the early stages of healing. Because skin stability requirements are lower for gauze, it can be safely applied even when the skin is still fragile. It is especially gentle, which makes it suitable when you are uncertain about the skin condition. The main disadvantage of this technique is its complexity. Compared to commercially available elastic wraps like Coban, gauze wrapping involves more steps and requires more time and effort to apply. That said, its therapeutic effects are very similar. This video, made by Shuhan Yang, senior occupational therapist, will demonstrate how to use gauze to wrap the fingers and palm of the hand as a pressure therapy technique for managing edema and controlling hypertrophic scarring after burns. Let's look at what you will need. To begin, prepare the following materials. 2 by 2 inch gauze pads. These will be unfolded and layered to form the wrapping strips. 5 finger sleeves or tubular gauze sleeves, one for each finger, to help secure the wrap and provide light compression. Elastic bandage, approximately 4 inches wide. This will be used to wrap the palm and forearm. Medical tape for joining gauze strips and securing the ends of the wrap. Scissors for cutting gauze and tape as needed. In this video, we'll be using non-woven gauze, which has a slight stretch and is softer on the skin. If non-woven gauze is not available, you can substitute with regular gauze, though it may be a bit stiffer and less elastic. Keep in mind that this method involves multiple steps. Organizing your materials in advance will help make the process smoother and more efficient during application. The first and most time-consuming step is preparing the gauze strips for finger wrapping. Start by taking a single 2 by 2 inch gauze pad. Unfold it completely until you reach the thinnest, flattest layer. If you're using non-woven gauze, you'll notice it has a bit of stretch, which can help during wrapping. If you're using regular gauze, it won't stretch as much, but it's still usable. Next, fold the gauze lengthwise once to reduce its width. This creates a strip that approximates the width of Coban, making it easier to handle and wrap around fingers. At this point, try a test wrap on a finger. You'll quickly notice that a single strip is not long enough to wrap the entire finger. That's why we need to join multiple strips together. To do this, prepare a second piece of gauze, unfolded and folded in the same way. Overlap the end of the first strip with the beginning of the second, and secure both strips with medical tape. A strip of 1/2 inch or 1 inch wide tape works well. Repeat this process until you have one long strip for each finger. Since we have 5 fingers, you'll want to prepare 5 gauze strips, each long enough to complete one full wrap. Whenever possible, prioritize using non-woven gauze because it's gentler on healing skin. But if only regular gauze is available, that's fine. Just make sure to handle it carefully, especially if the patient still has open wounds. And remember, if there are open wounds on the hand, always complete wound cleaning, dressing, and fixation first, before applying the gauze wrap for pressure therapy. Now, let's begin wrapping the fingers. Start with the patient's hands supported and the fingers relaxed. Wrapping should start right in the middle of the fingernail and continue all the way to the base of the finger, distal to proximal. With each round, Overlap the previous layer by about half to 2/3 to ensure even pressure distribution. Make sure to leave the fingertip exposed. This allows for easy monitoring of circulation, skin color, and capillary refill during treatment. Because gauze is a loose material, it can unravel or shift during wrapping. After each turn, press the gauze down gently to keep it secure and close to the skin. There's no need to pull or stretch it tightly, just make sure it lies flat and snug. When you reach the base of the finger, secure the end of the gauze using medical tape. Next, slide a finger sleeve over the wrapped finger. Stretch the sleeve open and roll it down gently from the tip toward the base. This helps prevent the sleeve from catching on the gauze, which could otherwise cause it to shift or unravel. Repeat this process for each finger. If a strip is too long, trim off the excess before taping. If a strip is too short, simply remove it and join a longer piece using the same method as before. There's no single correct wrapping direction. Use whatever hand position or wrapping angle feels most natural to you. Each therapist may find their own rhythm and preference. To streamline your work, prepare medical tape strips ahead of time and stick them on the edge of a table or your forearm for easy access during wrapping. Some fingers, such as the pinky or thumb, may need shorter strips. Others may require additional layering for better coverage and pressure control. The goal is to ensure that each finger is neatly wrapped, evenly compressed, and securely fixed, while still allowing for comfort and safe movement. Once all 5 fingers are wrapped and covered with sleeves, you're ready to begin wrapping the palm and forearm. Elastic bandage is used to wrap the palm and forearm. We'll be using a 4-inch wide elastic bandage. Before starting, you may find it helpful to cut a hole in the bandage for the thumb to pass through. This helps anchor the bandage and prevents it from shifting during use. To do this, fold the bandage and cut a small slit about the length of a single finger joint near the lower third of the roll, leaving at least 2 finger widths of material between the edge and the hole. Avoid placing the hole too close to the edge, as repeated tension during wrapping can cause the hole to tear. Now pass the patient's thumb through the hole so the bandage rests comfortably against the base of the hand. Begin wrapping from the distal end of the palm, just below the fingers, and work proximally toward the wrist and forearm. Wrap in smooth, even layers, overlapping each round by half to 2/3. Keep the pressure light and consistent. There should be no pinching or bunching. If your wrap becomes uneven, or if the bandage begins to curl or roll, simply stop, adjust the position, and rewrap as needed. There is no need to pull tightly. The goal is gentle compression, not constriction. As you continue wrapping up the forearm, check for any skin injuries or scar areas along the way. If there are small wounds, be sure they've already been cleansed, treated, and covered with appropriate dressings before pressure is applied. When you reach the end of the bandage, check whether additional coverage is needed. If not, you can secure the wrap using medical tape, ideally a 1-inch wide strip for better hold. If more length is needed, simply start a new roll and continue wrapping upward, overlapping slightly with the previous layer. Alternatively, if you prefer not to use tape, and there are no scars or fragile skin near the terminal point, you may gently tuck the end of the bandage into itself. However, This method should only be used in areas free of injury, as it may cause friction or localized pressure point over scarred tissue. As you finish the wrap, there are a few key points to keep in mind to ensure both safety and effectiveness. Compared to Coban, gauze wrapping for fingers combined with elastic bandage for palm, wrist, and forearm doesn't offer the same ability to provide pressure directly at the base of the fingers, particularly around the metacarpophalangeal joints, or MP joints. To ensure the skin is fully covered, we often wrap the elastic bandage slightly higher over the back of the hand. However, if the elastic bandage goes too high above the MP joints, it may restrict finger abduction, making it harder for the patient to spread their fingers apart. So, it's important to strike a balance. Wrap high enough to fully cover the skin, but avoid limiting joint movement, especially if finger mobility is a goal of treatment. Another limitation is that the elastic bandage cannot provide compression to the finger web spaces. If you need to increase pressure in those areas, you can use a simple reinforcement technique. Take a folded 2x2 gauze pad and place it between the fingers, either under the bandage or on top of it. If placed on top, secure it with medical-grade 3M tape over the elastic bandage. Applying the pad externally allows for more compression without causing friction against the skin, and it also gives you more control over the pressure level. This technique of combining the use of gauze with elastic bandage helps you closely approximate the focused compression effects of Coban while still using more accessible materials. Finally, always double-check that fingertips are visible for circulation monitoring. The patient reports no numbness, tingling, or discomfort, and the wrap remains smooth without folds, bunching, or gaps. With good preparation and careful technique, gauze wrapping can be a safe and effective option for patients who need pressure therapy, but may not have access to more specialized materials. If you'd like to dive deeper into the rehabilitation management of hand burns, including how to use pressure therapy effectively throughout different stages of recovery, we invite you to explore our online courses. You'll find practical, evidence-based content designed for therapists who want to advance their skills in burn care and hand therapy. You can find more information on our website or in the link provided below. Thank you for watching. Remember to subscribe to our channel for more burn rehabilitation-related tips and videos, and visit our website for news about our latest training programs.